Hi, I'm Dr. Dean, and this is just a short informational video on eye pressure. So when we talk about eye pressure, we normally, specifically looking at glaucoma, which is a condition that causes damage to the optic nerve and can lead to blindness. But whenever you go for a consultation with any eye specialist, you'll have your eye pressure measured. Typically, most patients are quite scared of having their eye pressure measured. I think they're normally used to what's called an air puff tonometer, where it blows a puff of air in the eye and that helps to measure the pressure. These are not normally used in ophthalmology settings. There's two main ways that we measure pressure. I think first to understand, when we say pressure, a lot of patients get confused between blood pressure and they say their blood pressure is dropping and is that affecting the eye pressure. It's unrelated to that really, and it's really simple to think. If you think about the eye like a soccer ball, the eye itself is under pressure, or like the tire of a car. If you inflate it with more fluid or air, it becomes harder and it has more pressure. If you remove air or water or something from within a closed container like a soccer ball, the pressure becomes lower. So we're really measuring what is the pressure of the eye itself. And the way we do that normally in an ophthalmology setting is either a Goldman applanation tonometry and now more commonly rebound tonometry. So a Goldman applanation tonometer looks like this. This device attaches onto the slit lamp, and it has the ability to change the amount of force that we apply, and there's a special attachment here with a prism on it that we look through, and so this gently touches the surface of the eye. So we push that onto the eye, and there's a certain endpoint we look for through that prism by adjusting this pressure, and that helps us to determine what the pressure in the eye is. And this is the gold standard. This will probably give us the most accurate pressure. To do this, we need to apply a drop of anesthetic on the cornea, because this is obviously going to touch the cornea. And when it touches the cornea, if the eye hasn't been anesthetized, it's going to be very uncomfortable. So it requires a drop of anesthetic, and it also requires a little bit of fluorescein dye. So that can be in the drops, it can be on a little strip, and that gives the eye a slight orange color that we use a blue light to fluoresce with to help us to determine the pressure. So that's Goldman applanation tonometry. Some patients do struggle with it if they're very sensitive eyes. Sometimes we have to try and open up the patient's eyes to get it onto the eye, and that affects the accuracy of the reading, because now we're fiddling or pushing on the eye. So the best way to do it is for a patient to be calm, relaxed, to look forward, to try and avoid blinking, and then to have this just gently touching on the surface of the eye with the eye anesthetized. But some patients do struggle with it. The other more common way of checking pressure is with rebound tonometry, which is a device like this or something similar. There's a few of them on the market. And essentially what it does is it's got a small probe, which I'm going to take out here. You might not be able to see it, it's quite small. So there's a very small probe with kind of a little plastic mushroom on the end like that. And that goes inside the probe there. And how this works is that this little probe jumps out, touches the surface of the cornea, and then bounces back. And depending on the force that it bounces back, a calculation is done to determine what the pressure is. So we take multiple readings with the left eye or the right eye, and this bounces out and touches the cornea. Now, because this is so small and the force that applies is so small, most of the time patients aren't even aware, they can't feel it. It doesn't require an anesthetic at all. It's very useful. It can be done in children and adults, and so it's often very well tolerated. It can be used in the upright position, but it can also be used with the patient lying down. And obviously in the clinical setting, when a patient can't sit at the slit lamp, because that's the only real way you can do a Goldman applanation tonometry, is normally at the slit lamp. This is very useful if a patient is in a hospital bed or is admitted in hospital and can't get to the clinic. There are other ways of measuring pressures as well, but these are the two common ways you'll find when you're visiting an ophthalmology practice. And it's really an important part of assessing a patient. It's one of what we would call the eye vitals. Your vision is one, your refraction or what glasses script you have, and then your eye pressures. It's a really critical part of any assessment. So if you visit an eye specialist, you definitely will have your eye pressure measured, likely with one of these two methods. So it's just important to understand what it is, what's happening to you, and why we need those readings. I hope this has been helpful, and if you require any more information, please feel free to contact us.